So there was a question on how to treat H. pylori in children less than 7 years. Now, generally, almost everyone in Africa has H. pylori, including children. So if the H. pylori is not if the child not getting any problem like pain in the stomach, please don't go on giving the child antibiotics to treat the H. pylori. Because 90% of Africans, we have H. pylori, but we don't have ulcers. It's not disturbing us. So giving antibiotics to treat it is not useful, especially in children. So there's a difference having H. pylori and having H. pylori plus pain or ulcers. These days, people are going testing in the labs. They just walk to a lab by themselves and they ask for a test, and then their phone, they have H. pylori, test positive, then they begin treatment. But I would advise that if you're having stomach pain or anything disturbing you, you go to a medical doctor and they assess it, because there could be many factors causing it. Don't just go and test for H. pylori. Now, if you have H. pylori, if it is found in a child and you want to treat it, there are recommended antibiotics to treat H. pylori. And that is it. Normally we use amoxicillin and metronidazole, or clarithromycin and metronidazole. The combination of the two can work. But normally they also add antacid or something to block the acid production. However, from the research that we did some years back, and this is also established by other scientists, that if the acid in the stomach is low, the pH is low, the H. pylori will not be killed by the antibiotics. So if the pH is less than 5, even if you give what type of antibiotics, the H. pylori will not die. And that's why you see people have treated H. pylori, they have taken antibiotics, they have taken drugs, the H. pylori is still there. Why? Because the pH of the stomach is below 5 and H. pylori is hiding. We call it hibernation, not multiplying. When the H. pylori is not multiplying, it does not take it doesn't take in the antibiotics which you are giving. If it doesn't take it in, then it cannot kill it. Because for bacteria to die from antibiotics, the bacteria must take in the antibiotic. Then the antibiotic can block the certain enzyme in it, then the bacteria can die. So if the bacteria is hibernating, not multiplying, it will not take in the antibiotic, so it cannot die. So the question is, how do you reactivate the H. pylori so that it can swallow the antibiotic and die? That's the research that we established in genetic research, but also other scientists have found that for you to kill H. pylori, first raise the pH to above 5. Then you wake it up. Then you can give antibiotics, or clarithromycin, azithromycin, amoxicillin, or metronidazole to kill it, because now it's awake. It's now eating. And the only drug that I know that raises pH to above 5 is Genacid. That's why when somebody has H. pylori, we first give them Genacid for 1 week or 2 weeks to raise the pH to above 5. Then we add the antibiotics now to kill the H. pylori, which is now awake. So how do you treat H. pylori and kill it? 1, raise the pH above 5 using Genacid, any medicine which you may be knowing. Then when the pH is above 5, then you can add antibiotics, then H. pylori will die.